My name is Judith. I was diagnosed with MS 8 years ago. 5 years ago, the mobility in my legs stopped working, and it hasn't worked since until I saw Dr. Lonnie Herman. I've had 2 treatments, 6 months, and now I can move my legs again. I am very excited about this, and he will show you a video of me not moving my legs. That's in his office, and the next video is of me moving my legs. So there is quite a bit of improvement in just this little amount of time.
Your knees up, kick your shins up. Are you suffering from multiple sclerosis? Do you know a person, a loved one, a friend who suffers with multiple sclerosis, with symptoms like where they can't move their limbs, where they are unable to feel the sensory in the hands or in the legs and feet have been greatly reduced? Maybe vision has become distorted. Maybe their balance is really poor. Maybe this individual cannot control their bladder as they once did in their life. Multiple sclerosis is a condition where, as medicine says, is the immune system is attacking the nervous system tissues. And when an MRI is taken, we can see on the MRI image that there are lesions in the brain stem, in the spinal cord. And these lesions they look like white marks, like penciled in marks. I'll actually show an image up here next to me on the screen of what a brain or central nervous system tissue looks like when there are lesions, and which is one of the steps that they can use to diagnose multiple sclerosis. My name is Dr. Lonnie Herman, and with this video you will see the amazing changes that are happening in a woman's body. She's 31 years old. She has suffered from multiple sclerosis, or diagnosed with multiple sclerosis, for 8 years already. This is, right now that I'm filming this, is September 25th, 2018. This patient, which again you'll see her in this video, she found me and started working with me back in January of 2018. And we've already seen some incredible changes, one of which I will be sharing with you in this video footage of what's happened for her, which is just truly amazing, and one of my greatest so far, I'll say greatest rewards is seeing the incredible expression of joy and hope that she and her family members are now sharing in what's really truly like just incredible taking place in her body. This woman has on an MRI in her past 36 lesions that have appeared in her central nervous system tissue, 36 lesions in the brainstem tissue. Let's be more precise. Again, she's been diagnosed for 8 years with multiple sclerosis. She was or has been in a wheelchair for 5 of those 8 years, and those 5 of those 8 years of MS, she has been totally, the legs, I will say, totally immobile. Total incapacitation of her limbs, of her lower limbs. The legs were completely numb from the waist down. Her legs were totally immobile. There was no muscle control between brain and her thigh muscles or her hamstring muscles or the glute muscles or the calf muscles or her toes. She couldn't move her toes. She couldn't move her feet. She was not able to actually extend her knees or her shin to be able to raise the knee or the shin from resting position in any chair, including but not limited to the wheelchair. She also has been unable to up until recently. She's been unable to sit up by herself from a supine or lying back position on her back. Somebody had to help her get up. She's now had some incredible changes with that as well, which I'll talk about in just a minute. I'm going to share with you in this video the unique examination findings from the exams I perform with her in my clinic, which have provided protocols for her to remove what I believe is causing, and it's not just that I believe just because I'm making this up, this is coming from extensive research in immunology, where I was actually, one of the first classes I took in immunology was led by one of the world's most recognized immunologists, Dr. Vojdani. I took that in postgraduate studies in my postgraduate neurology studies, postgraduate neurochemistry, neuroimmunology studies, as well as I've gone through extensive studies and research in dental work and the connection of dental teeth and the metals in the mouth and the infections in the mouth that could be connected to nervous system disorders or autoimmune disease disorders. And there's endocrinology postgraduate studies and a lot of different studies that I've done in the past 11 years in my work. But I will tell you that the infections and the toxins, hidden infections, we've got to pinpoint these hidden infections and toxins which exist in people's tissues and have and provide a safe and effective remedy that will remove the hidden infection and toxin in the tissue. Now, let's go and watch this video of this patient. I'm going to show you. I'm going to put it up on the screen here. Here she is in my clinic. It's a very brief video. Here she is in my clinic, not able to move her legs. You'll see her. Now, I did I will say, with concern of her own, let's just say, privacy, I did not include her face in this video. She was wearing the gown. Her significant other is holding her up on the exam table. And as you'll see, and you'll hear me trying to explain or ask her to move her legs, she's sitting on the exam table. She couldn't move her legs. And she has not been able to move her legs for 5 of the 8 years with her multiple sclerosis condition. And with all the different medical treatments that provided her, she lives in Canada, all the different medical treatments provided her, as well as all different alternative treatments that she's tried until now, you'll see that she could not move her legs. And you're also now about to see that she can move her legs, and with great, I'll say great ease, which is pretty incredible. So let's watch those 2 videos. Kick your knees up, kick your shins up. All right, isn't that just amazing? It is incredible. 5 years of not being able to move her legs, she can now extend her legs in that seated position. She can extend her shins up, kick her feet up in the air. Pretty incredible. Pretty incredible. This is real. This is real. Now, she had in her MRI before we met, and we have not run a new MRI yet, but still you see better function happening that is totally undeniable, and she is there in the video stating that that is her and this is what's happening for her. She had a lesion in her cervical spine between C3 and C6. She has lesions in both hemispheres of the brain, a lesion in the pons of her brainstem, lesion in the midbrain, and a lesion in the medulla oblongata, which is from the upper brainstem through the middle part of the brainstem through the lower part of the brainstem, and including the cervical spine, including both hemispheres of the brain. Again, 36 lesions were recorded in the MRI. Now, I will tell you that something else that's really incredible for her that she's experiencing right now is and going backwards. And I will tell you that there's another video. I'll put up the image, the screenshot of the image that you'll see on my YouTube channel, the image of a video that I did with her right after she had completed her first protocol with me, where she was already experiencing, and very happy to share, experiencing some incredible changes in the physical functions of her body. One of which she had a uncontrollable bladder disorder. And her bladder, she actually, as you'll hear in that video, she had to sit on the toilet when she was drinking something because the body would just release fluids that were in the kidney to the bladder. It would just come right out into the toilet. She had to actually sit on the toilet while drinking because she had an uncontrollable bladder, overactive bladder disorder. Again, she would just release fluids immediately upon drinking another liquid. So at that time that we shot the first video, or recorded the first video in my clinic after her first protocol, she was able to drink some fluid and have zero urge to go to the bathroom to urinate for 20 minutes after a meal or drinking. Now what we're experiencing after her second protocol, she's following her third protocol right now, which from her most recent exam was August 20th of 2018. After her second protocol, she was able to, what she's telling me, she has no urge to go to the bathroom for 6 hours after drinking a liquid. So she went from uncontrollable, having to sit on the toilet while drinking something because the fluid would come right out of her, to now she doesn't feel an urge to go to the bathroom for 6 hours after drinking something. That is just amazing. How many people on this planet have uncontrollable overactive bladders? And the pons of the brainstem is where the bladder reflex center is. So she has lesions in there in the MRI. Again, even with the lesion that's there, and we have not run a new MRI yet, but what we're seeing, what she's experiencing, what she can tell you is that she can control her bladder now. And I'll say it's not only the control, but she has no urge to go for 6 hours after drinking, which is incredibly, it's just remarkable. Something else that was going on in her body, and I'll get to some lab findings in a few minutes here, or exam findings. Something else that was going on in her body was that she had complete, again, I said the numbness in her extremities. You'll hear in that other video that I pointed out for you to watch as well, is that she had a very ice cold feeling in her fingertips, ice cold feeling from her knees down to her toes, around the calf, both sides of the calf, the shin, and the top and the bottom of the foot, all the way down to the toes. Every surface area from the knee down to the toe, top, bottom, and sides of both legs, they were ice cold, what she called icicles or ice cubes. They were frozen feeling. And now, since her first week of her first protocol, she has zero, and it has not returned, sustainable, complete relief of the freezing neuropathy feeling. Yet what was even more remarkable in this third examination with her, which I did on August 20th of 2018, is that she told us in the exam room that she actually can feel ticklish in her feet. She could feel somebody touching her legs. She could feel her clothes on her legs now. She could feel the shoes. She could feel a sock. She can tell that something is touching her skin, which she has not been able to do for years, which I believe it's about 5 years that she had that numbness neuropathy. Before we met, I will also say, and there's so much to share about her, but before we met, I will also tell you that she had gone through IV chelation, and it got her nowhere positive at all. And she has gone through Rebif medication that makes her sick. She took steroids that it was working for just a few days, but she felt a little better, but it really got her nowhere with the neuropathy, with the leg strength, with the ability to move her legs. She's done a lot of different treatments. So now what we're seeing again, as you just saw in the video I'm sharing here, and I'll show it again at the end because it's just too amazing and not to keep looking at this, that she can actually move her legs, and they were totally immobile. Totally immobile. In her first protocol, I found that in the stomach area, because she also had a very bad digestion problem, I found the Borrelia burgdorferi bacteria that's found in Lyme disease. I found the Borrelia in the pylorus, which is the part of the stomach that there's a sphincter at the bottom of the stomach that connects the intestine. Borrelia was down there, the Treponema pallidum bacteria, Babesia microti parasitic infection, trichinosis bacteria, as well as there were residues of Diet Coke, which is a toxic substance. Not only is it because of the aspartame fake sugar chemical that's in there that is known to be a neurodegenerative, neurotoxic substance, but also what we don't know is when they're using whatever water they're using to make a substance like Diet Coke. I'm not here to bash Diet Coke, please. I'm just saying that we don't know what's in the water. Is there any lead? Is it truly, totally filtered, perfect water that they're using to make the substance, this drink? So is there any lead, traces of lead in the water, any mercury that might be in the water? Are there any pesticides that might be in the water? There's a lot to think about when we're consuming certain substances. And we are like, think of your body like a t-shirt. If you took a white t-shirt and dipped it into water with a blue dye, the dye gets in the white t-shirt and it never leaves that t-shirt, and now the white t-shirt became blue. And no matter how many times you wash it and dry it, it's still going to have blue in it, even if it fades a little bit. So we are what we eat, and the chemicals that are in the substances that we drink can actually get in our body and stay there and cause interruption in the function, can cause stress, can cause immune reactions against these chemicals. The immune system is doing a job that it's supposed to do, which is attacking infections in tissues as well as trying to get rid of chemicals that are in the tissues. And now let me just point out, let me make an analogy for you. If you had to defend yourself against one person, and that person was the same size, speed, and skill and strength as you have a great chance of winning. If you were up against 50 people of the same size, speed, strength, and skill, you're probably not going to do too well. And I'm telling you that analogy because if you have, with your immune system, so many different chemicals and infections in your tissues, your body is trying to defend itself, and your immune system is trying to help defend itself and remove these chemicals and infections, but it's just not going to win. It's just not winning. So we see these terrible diseases like MS. I found as well in that first protocol, which was in January, the glial cells, Lyme infection in her glial cells. Glial, G-L-I-A-L, or microglial. These cells are the cells that repair your nerves and reproduce myelin for the white matter of your central nervous system and your peripheral nervous system tissues. So what would happen when these cells that are the cells that repair the nerves and reproduce the myelin, what happens when they're sick, when they're infected, when they have toxins in them? They can't repair the nerve, they can't reproduce the myelin. So it's not just, is the immune system attacking the myelin sheath? What happens when there's infections that could be attacking the myelin sheath? And what happens when there's infections like Lyme inside the cells that actually repair the myelin, reproduce the myelin, and repair the nerves? So think of this analogy. If you think of, let's say, like a car production company. Let's just call it ABC Car. Well, let's use a real name. So Ford makes Mustangs. And let's just say that the Ford factory that makes the Mustangs, they have 1,000 workers who can produce 100 cars a day. Quality cars coming out of the Ford factory, okay? And when after Super Bowl Sunday, these workers come in all hungover in the morning. Some of them did some drugs. They all got drunk. They're really hungover. They just can't work. They're really sick. And so what would happen when those workers are not able to do the job to produce those cars? Are we going to get the cars produced? No. If we even get some produced and they're not able to produce a quality vehicle, so just understand that the factory workers in your central nervous system called glial cells that repair the nerve and reproduce the myelin, what happens when they're sick and they can't do the job? So I found the glial cells with Lyme provided remedies to remove the Lyme from the glial cells. I actually found also that in parts of her brain she had some mercury dimethyl methylchloride, and a bit further she had Lyme in her brain, and she had in that first protocol, there was one more that I wanted to share here. It was Lyme that was in her temporal lobe and Lyme in the olfactory lobe of the brain. Okay, so there were remedies. There was some other that here that's a bit advanced to describe right now, but we provided remedies. My clinic provided remedies to remove these different infections from those tissues that I said. She came back in April 2018, and you could see the first video. Again, I'll show the screenshot of that video on my YouTube channel. You could watch and listen to the recovery that she was already experiencing at that time, which was truly amazing at that time and still is. In her second round between April and August, which now after August, at the August visit with me in my clinic in South Florida, you could actually see the leg improvement, the function improvement in the legs, as well as she's now able to sit up from a lying down position, which she had no core strength before, and now she can sit up. So I found in the April visit, which allowed her body to improve to the point where she can now move her legs on her own that were paralyzed for 5 years with MS, I found xylocaine. Xylocaine is a local anesthetic numbing agent that they use in epidurals. They also use it to do a dental procedure. It's lidocaine based, which is the numbing agent. What do you think happens? Let me ask you this question. When they inject a lidocaine type agent into a tooth to numb a tooth to do a root canal or do a filling or pull a tooth, where does that chemical go when the numbing agent wears off in the mouth? And let's go even a step further. How do you function? If you can just imagine for a moment when you're sitting in the dental chair and the dentist injects that chemical, and then after they're done doing the job in the mouth of filling a cavity or pulling a tooth and you're bleeding, and then they give you something, a cup of water to rinse your mouth out with and spit it out in the sink that's next to the dental chair, are you functioning perfectly at that time? Are you able to swish around the liquid in the mouth? Are you able to spit with great thrust, with great velocity? Or does it feel like you might drool a little bit and you can barely, you're afraid that you might not even reach the sink when you're trying to spit that out of your mouth? The motor control in your mouth and the sensor of your mouth is down because that local anesthetic did the job. I'm not knocking the local anesthetic, but I'm telling you this, I'm asking you this and telling you this, where do you think that chemical went in the hour or so after the numbing agent wears off and you could feel your mouth again? Where did it go? Did it just evaporate into thin air? Or did it travel into another part of the nervous system and maybe stay there? Again, the analogy, a white t-shirt in water with blue dye, the white t-shirt becomes blue. The chemical doesn't leave the t-shirt. The chemical doesn't leave your nervous system. As much as they say it all will, some of it can remain in your body and saturate into the nervous system tissue. I found her brain loaded with that xylocaine chemical. I found the glial cells loaded with the xylocaine numbing agent. What happens to those factory workers that are the central nervous system cells called glial cells that are to repair the nerve and reproduce the myelin? What's going to happen when they are numb from the local anesthetic that's in them? What do you think? Do you think they can reproduce the myelin? Do you think they can repair nerve tissue? No. Can you function normally when it's in your mouth? No. The mycoplasma bacteria and Candida albicans also in those glial cells I found on this day. Remedies were provided to remove all of those that I just mentioned. I also found in the white matter of the nervous system. I found xylocaine in there as well. I found the xylocaine in her hypothalamus. I found xylocaine on the optic chiasm. Behind your right and left eye, you have nerves that come out, the optic nerves that join, they cross in the center of the brain and they go back to the opposite ends, parts of the brain for visual function. So the right eye is seen in the back of the left brain. The left eye is seen in the back of the right brain in the occipital lobe of the brain, and then the parietal and temporal lobes of the brain. Without making you into a doctor here, I'm just going to say that those nerves connect at what's called the optic chiasm. So that optic chiasm has to be clean of infection and toxin, because when there is an infection or toxin on that optic chiasm, it can distort the sense of what we're trying to see through our eyes. Okay, so xylocaine was on that optic chiasm, and I also found xylocaine in her stomach, in the Peyer's patches of her intestines. Peyer's patches are lymph vessels in the intestines. So if you want to follow the reasoning that a leaky gut causes everything in the body, well, what's going to happen when you have the xylocaine numbing agent from a previous procedure that you've had done in your body, in dental work or a epidural, where that's in part of your brain, it's in the intestines. The brain can cause a leaky gut. The leaky gut can cause the brain problem. Well, I'm going to tell you that anything can be going on here. I don't follow the leaky gut scenario anymore. I ran those labs multiple times on patients, and there were too many times that people with MS or with lupus or with diabetes or neuropathy in the body where the leaky gut came up negative. So that's a total possibility for you without getting into too much detail about that. Again, remedies were provided to remove the xylocaine effectively and efficiently out of her tissues that I just mentioned. When she came back in August for her visit, which you're seeing again, that amazing recovery, where she's able to move her limbs for the first time in 5 years and sit up and control her bladder. So amazing recovery so far. I did a follow-up exam with her, very detailed, using certain neurological examinations and doing a very unique examination that allows me to peek into the tissue without taking a biopsy. I won't get into great detail of how it's done right now in this video. I just want to show you this amazing results and actually tell you the kind of findings that I found in her. I found with her the white matter of her central nervous system. There were infections, mosquito-borne illnesses in her tissues. The West Nile mosquito virus in her white matter, the dengue fever virus from mosquito in her white matter, malarial parasitic infection in her white matter, scabies infection in the white matter of her central nervous system. That's where lesions occur. St. Louis encephalitis virus in the white matter, the polio virus in her white matter, parvovirus in the white matter of her central nervous system. I also found in her glial cells, again, the cells that repair nerve and reproduce myelin, scabies infection, treponema bacteria, very dangerous. Malarial parasitic organism in those glial cells, St. Louis encephalitis virus in those glial cells, the polio virus in the glial cells, the swine flu, yes, H1N1 swine flu virus in her glial cells, the polio damaging the myelin, dengue fever damaging her myelin, Lyme infection with the myelin. I also found in the part of the brainstem called the reticular formation. The reticular formation is a tissue that's very complex. It helps to regulate from brainstem to brain and brainstem to body sensory and motor control, including digestion, including heart rate, including limb function. It does a lot for us. Without getting too detailed about it, I found the polio virus and the swine flu H1N1 damaging her reticular formation. I found on the optic nerve the polio virus, the optic chiasm the polio virus, the optic chiasm also the swine flu H1N1 virus. Any mosquito, look, if you even go and look at Bill Gates, which I read on Twitter recently, we're going back probably a month and a half ago, who's a philanthropist, you know him, Microsoft around the world. That man travels to do work for humankind. Whatever you want to believe about him, I'm just going to point out that he actually put up on Twitter recently that he hates mosquitoes. I'm paraphrasing it, remember the exact verbatim of what he said, but it was, I hate mosquitoes basically, and that mosquitoes can cause more debilitating disease and more death around the world than, and I forgot what he compared it to, like car accidents or plane crashes. I forgot what his comparison was, but that the mosquitoes are transmitting serious disease causing infections into the body. And I'm going to ask you this, were you bitten by a mosquito before? Probably yes, maybe one time in your whole life. Did you ever catch a mosquito that bit you and send it to a laboratory and ask the laboratory to find which viruses were in that mosquito, which parasitic infections were in the mosquito? You don't have to be living in some other third world country to get these kinds of diseases from mosquitoes. I found that Lyme infection was in her cerebral spinal fluid. Lyme infection in the fluid. That fluid is around and throughout the entire brain, brainstem, cerebellum, and spinal cord. All of your central nervous system tissue is protected by and saturated with cerebral spinal fluid. I found Lyme infection in that fluid. I found the Peyer's patches, these lymph vessels of the intestines. I found the H1N1 swine flu virus. I also found in the pia layer of her meninges. The meninges, you have 3 layers of protective meninges, sort of like a skin-like sheath of tissue around the brain and spinal cord. The pia layer is the closest layer to the brain and spinal cord. The pia layer has a direct communication with the central nervous system. The pia layer, I found the malarial parasitic organism as well as the polio virus. Remedies provided to her to remove those as well. I also found those glial cells infected with the dengue fever virus. I said before earlier in this video that I found the polio, I found the malarial infection, I found the H1N1 with those glial cells that repair and reproduce central nervous system tissue. I found the scabies and the treponema pallidum. Well, I also found the dengue fever virus and the rotavirus damaging her glial cells. I found the H1N1 swine flu damaging the brain and the West Nile virus on the optic nerve, which again, the optic nerve I said earlier in this video with the polio virus. So these are, there's a very thorough, unique kind of examination that I perform in my clinic to figure out what's driving these nervous system disorders and autoimmune disease disorders. You can see from the video again and from her providing a statement that she is noticing finally, after years of suffering and years of searching, that she is, from my help, Dr. Lonnie Herman here, my help, she is getting the function back in her body, and it is truly amazing. We can find these different infections and provide safe and effective remedies to remove these infections and chemicals from the body. There are no laboratories around that you're going to find these in these to discover if there's xylocaine in the brain. There's no laboratories around that you're going to find if there's a West Nile virus that's in the central nervous system tissue. There's no laboratory you're looking to see. You're not taking biopsies of the brain. You're not taking samples of the spinal fluid. You're not taking samples of the Peyer's patches of the intestines. No, you don't need to be cut up to be finding what's in the body. This is work that's based on research from biophysicists. I've got extensive research in functional neurology, neurochemistry, neuroimmunology, endocrinology, blood chemistry analysis, hair metal analysis, and urine analysis. I've done a lot of different laboratories. I've taken a lot of postgraduate studies in endocrinology, biochemistry, dental work, root canals connected, and the infections in the mouth and toxins in the teeth that could lead to disease in the body. Listen, The results are speaking for themselves in this video. Share this video with a loved one. They deserve to know, they deserve to see that results are really finally happening for a person, and you just might be able to help that person help themselves start to recover from their own condition. Little bit more, you can actually subscribe to my YouTube channel. I'll put up the link here, as well as you can just click the subscribe button that's down in the corner of the screen on this video, as well as turn on notifications so that you'll see when I'm putting new videos up on my YouTube channel. You can actually scroll through a lot of the videos here on my YouTube channel, and you'll be able to see that there are some pretty amazing recoveries happening for patients in my clinic from all kinds of different types of chronic pain disorders, chronic illness, invisible illness disorders, neuropathies and diabetes and lupus and heart disease and so on. You can find me on Facebook, like me on Facebook. You could follow me on Instagram and even on Twitter and even LinkedIn. I put up information there as well. And I look forward to helping you or a loved one who's suffering with this condition as well as other conditions that we have a great chance of helping people recover from their disease. You can call my clinic for an appointment. The number here is 954-370-3100. That's 954-370-3100. I'll even put the email address of my lovely assistant. She's happy to help you schedule your appointments in my clinic, and we can get started with helping you start to figure out what's causing your condition and safely and effectively removing these different hidden infections and toxins from the tissues in your body so your body can start to recover. Also, let me just share this, that insurance policies don't recognize the kind of work I'm offering. This type of work, my work, is more of an investment in yourself. It is going to be an out-of-pocket expense. There is nothing I can do about what insurance covers or doesn't cover. I can only provide great and valuable service for people to help them start to recover from their disease. So this is really something that you and your family can make a decision to do and come to my clinic, and we can get started to understand your body in a totally different way and provide you a very unique method that can actually help you begin to recover your function. You have a great chance of getting your life back, getting functions back. And again, here is proof again. I'm going to replay that video. To end this video, I'm going to replay her video of her speaking on behalf of what's taking place in this clinic, as well as the video of the before starting and the now improvement of what's taking place with her legs, where she was totally immobile, paralysis of her legs for 5 of the 8 years with her multiple sclerosis, where nothing, IV chelation didn't help, medicines didn't help, other kinds of alternative therapies did not get her the results. And I'm very proud and very happy to say, and she is too, very excited to share this with you all, that this is working for her. And I look forward to helping you as well. Again, call my clinic, email my assistant. We're happy to help you. People do come to my clinic from around the world, literally. In the southern part of the U.S., I have people from the United Kingdom frequently coming here, from Canada, from Mexico. We have people from South America. We have people from as far as Thailand and New Zealand and Norway and Netherlands, Belgium, China has come here. Somebody from Russia has come to my clinic. So there's different areas of the world where people are coming from. Romania, we've had coming here. There are different areas of Australia coming to my clinic. We've had people in different parts of the world for people coming to my clinic for this unique work I'm offering. Do your homework. Follow me on my YouTube channel and look through the videos and listen to other patients about the recovery that's taking place for them in my clinic. Let me share this one more point, and then I'll just tell you I look forward to helping you and seeing you, is that the speed of recovery varies from one patient to another. The speed of recovery varies. One person may have only one infection, which is rare, but one infection, you get another person who has 50 different infections in their tissues. It's going to take time to clean out those tissues. But again, in just a 6-month period, the amazing positive changes that are taking place for this woman, it's happening pretty rapidly for her, and it just might be that way for you as well. I look forward to helping you. See you soon.
My name is Judith. I was diagnosed with MS 8 years ago. 5 years ago, the mobility in my legs stopped working, and it hasn't worked since until I saw Dr. Lonnie Herman. I've had 2 treatments, 6 months, and now I can move my legs again. I am very excited about this, and he will show you a video of me not moving my legs. That's in his office. And the next video is of me moving my legs. So there is quite a bit of improvement in just this little amount of time.
Your knees up, kick your shins up.